Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all I do. I've been doing fat transfer for about 15 years now, and one sees the evolution of fat transfer. It's a much more elegant, much more specific, much more long-lasting procedure or treatment than it used to be, and that really is because it's technique dependent. A lot of people come to me and ask me, Dr. Shapiro, what is fat grafting and where is it used in the body? Where can it be used and how? Well, fat grafting really is when I take fat from one part of the body, I take it, I process it, I centrifuge it, and I re-inject it in very small amounts at the same sitting into an area where I want to see more volume. That can be areas of your face, whether it be your cheekbone, along your jawline, beneath your eyes where people get hollow. It could be people's lips, anywhere, temples. It's also very common for me to take fat as fat transfer and add it into people's hips to give them more of an hourglass shape, or into their rear end to give them a Brazilian butt lift. So you've heard of that before. What that is actually adding your own fat to get radial expansion of your rear end to make it look firmer and tighter and more youthful. So all of these are different applications of fat transfer or fat grafting. And why does it work? Because when I take that fat and I spin it in a centrifuge, I'm taking that fat as a living tissue. I'm not re-injecting it as a filler. I'm re-injecting it as a transplant. So we want to see it get its own blood supply. So it's very technique dependent, and I think the longer that you've been doing it and the longer that you have time to understand what techniques work and what don't work for fat transfer, I think is the most important thing around. But all in all, fat transfer has revolutionized, I think, plastic surgery. I think it's the most important contribution in the last 10 years or so. I use it every day of my practice. I use it in my facelifts all the time. I use it in liposuction to fill irregularities. I use it to give more volume in the hips, in the chest, in the rear end. So fat grafting is an amazing, amazing procedure. To get an idea about what the results can be, go onto my website, look under different categories, whether it be the rear end, the chest, the hips, or the face. Fat grafting is here to stay. I think it's only to get better in time, and I think it is the most revolutionary thing that we've done in the last 10 years. Thank you.